The second case is a woman with depression, a middle-aged woman, moderate depression, and I add the nuance, although I'm not a clinician, of being endogenous, referring to a, correct me if I'm wrong, very simplistic classification, where exogenous is due to a more or less known reason, and endogenous has no known cause that could lead to depression. And I can liken it, for example, to a biochemical disorder. That is to say, an endogenous one might relate more to a biochemical issue involving alterations in various neurotransmitters. Therefore, I say that it is endogenous because I want to emphasize a much more biochemical mechanism. That is to say, if it were exogenous, I would probably go for royal jelly or a multivitamin. And if it were endogenous, I would look more for monoamines or everything, but with a little intuition. About this, there is a stress picture. Stress includes anxiety and depression. It's about adapting to stresses. In other words, anxiety and depression are basically the symptoms associated with something much bigger that is stress. That is to say, it's the physical and emotional capacity I have to adapt to some excessive stressor, and as a collateral effect, I might develop a picture of depression or I might develop a picture of anxiety. This woman also has chronic stress with nervousness and irritability. And it shows she handles her work as best as she can. On a couple level, well, it's as it is, older parents, teenage kids. In other words, a normal case, and so on. And she also has functional dyspepsia with intestinal spasms. By the way, she's on triptans, she has migraines. I'm putting that in parentheses, assuming let's do what we can and let's not do what we can't. Okay? Yes. Is that clear? Well, I'm not quite sure where to start, but let's take it step by step because this situation is a bit more complex. Well, let's start with stress. If we're in a master's program in integrative health, then basically it's about focusing on aspects like, hey, get more in touch with yourself, learn to manage well, meditate, breathe, do yoga, acupuncture, blah, blah, blah. Perfect. That's everything that could compete. When you look at the nervous system, the symptoms of that, stress, it's about adapting to some stressor, where we arrive at the concept that for stress, we need to turn to plant-based drugs that increase physical and mental resistance to stress, physical and intellectual fatigue, have immunomodulatory effects. Of course, stress from psychoneuroendocrinology is going to affect my immune system. I take a hit, and that's when I'm in trouble. So, Eleuthero ginseng, Siberian ginseng are the plants referred to as anti-stress and anti-fatigue plants. But I have a problem. What Eleuthero ginseng, what problem do I have? Remembering that part makes us nervous. In principle, it would be contraindicated, right? And what do I do? Well, when we talk about stress, there are two plants that I absolutely love, and they belong to the group of adaptogenic plants. And basically, one of them is Rhodiola. Well, of course, this is the problem. We have Rhodiola and Ashwagandha. They're amazing. Let me tell you a story. Okay, the concept of adaptogen, the one that is high brings you down, and the one that is low brings you up. When I presented my first book, it was a Friday family, over 100 people. And on Monday, I had to work and do a training for a few days. And I was so nervous, thinking, how am I going to train here if I can't even handle myself? So I took a product that contained Rhodiola, along with other things, with cofactors, magnesium, B vitamins, spirulina, covering the 3 phases of stress and a little bit of lemon balm, which is slightly sedative, so I was calm and alert. Amazing. I was able to do my work calmly because unlike an anxiolytic plant, I can sleep. It can calm me down so much that I can't handle day-to-day life. I can't drive. That's the concept of an anti-stress plant. An adaptogenic plant is one that calms you down and allows you to handle day-to-day life. And Rhodiola and Ashwagandha are perfect. Ashwagandha is the typical Ayurvedic plant. So I can turn to this type of plant because, as far as I know, I wouldn't have any issues with triptans. Example, Rhodiola. The chemical composition is quite complex. Phenylpropanoids, dental derivatives, flavonoids. Where basically most studies tell you that they need to be standardized extracts at 3% in rosavins. In other words, this would basically be the marker active ingredient that would indicate the pharmacological potency of this plant. In terms of action, it would basically be adaptogenic, antidepressant, and anxiolytic. Perfect because it covers everything this woman has. Plus, it protects me at a cellular level. Olga is a perfect cancer patient and also has anti-inflammatory, antioxidant, and immunomodulatory properties. The cancer patient can definitely use Rhodiola to calm anxiety with the side effect that it does other things for certain groups. Indications from the EMA show that the use of a monograph accepts its traditional use for relieving symptoms of asthenia such as fatigue and weakness. Perfect. And now regarding the indications, I don't know if this is the EMA or SCOP. It tells you that most clinical studies refer to its effectiveness on physical and cognitive function at different levels. It improves physical and mental performance, has effects on depression and anxiety, and enhances visual perception and memory. In other words, a person with stress and anxiety is going to improve in many aspects. So for me, it would be a completely accepted plant for this. Ashwagandha is the typical plant that comes from Ayurvedic medicine, from Hindu medicine, known for its long adaptogenic life. It's a bit like ginseng in terms of the concept of longevity. Vitanolides and vitaphenone would be the marker principles, meaning the extracts should be standardized with these marker principles. Have been described to have adaptogenic and anti-inflammatory effects. Okay. Well, perfect. It would be another interesting plant. Indications. It has been recently used to treat anxiety states, nervous hyperexcitability, asthenia, hypertension, and type 2 diabetes. In Ayurvedic medicine, it's recommended for treatment because we use the root, which is the part of the plant, for conditions associated with general weakness, rheumatism, memory loss, and spermatorrhea, meaning it's an adaptogenic plant. Interesting. Okay. Since there's physical fatigue, I would use jelly. Now, what jelly? Royal jelly, totally compromised. Let them hear me well. On the other side of the water, with fructose, 10 HDA, turning at 2%, and of European origin. And well, one good jelly. Okay, perfect. For me, jelly is an amazing vehicle agent. I put an active ingredient in and mix it with a good jelly, and it kicks in faster for me. In my opinion, it's a wild card. On is energizing, it's adaptogenic, and from my experience, it allows the active ingredient to kick in faster. Okay, perfect. I'm already acting against stress, but remember that they were suffering from dyspepsia, meaning the person with stress associated with the stress condition can present nervousness, irritability, anxiety, insomnia, and digestive disorders like dyspepsia, as well as muscle contractions. It's when they tell doctors, don't overlook someone here with a muscle contraction from stress or depression. Here, we have nervousness from stress and dyspepsia from stress managed by royal jelly and adaptogenic plants. You really have to get to the bottom of the problem. And in this case, we have nervousness as a consequence of stress, And we have dyspepsia as a consequence of stress, where I'm managing the stress with royal jelly and adaptogenic plants, but I also have to address the symptoms. I have to treat the dyspepsia because a rhodiola isn't going to improve my digestive function or muscle contraction. Are you there? So I'm going to go for those substances that are calming for the nervous system. And I need to focus on those plant-based remedies that are digestive because I have dyspepsia. So let's start with those substances for anxiety, for nervousness. I've already covered stress. By the way, B complex for the nervous system, the B complex DHA, that's a must, of course. It has to be a given. Where does anxiety brew? Basically, at the level of neurotransmitters, in this case, GABA, gamma, aminobutyric acid. Butyric, I don't remember anything butyric. Aminobutyric, that is, it's an inhibitory neurotransmitter. So, and don't get confused. So, when I have low GABA in the nervous system, the current is on. This means I'm dying of nerves with low GABA. So what do we need to do pharmacologically? Increase GABA. So when I increase GABA, turn off the current and I'm calmer. What increases my GABA? Anxiolytics. Is the Tankema 5 in place? Because it's better known as Transilium and so on, right? What increases my GABA? GABA. And what increases my GABA? Certain medicinal plants, because if I go, for example, then I go to the manual and I see that the plants for anxiety and nervousness are classified according to evidence backed by science. Valerian, passionflower, and kava. Plants whose use isn't fully established include hops, lavender, hawthorn, lemon balm, and plants that apparently, and this is also somewhat older information, like linden and so on. Hey, well, maybe I'm interested in going. As always, let's make a mix of several of them and you're going to the monograph. In this case, I think I've picked valerian. I see that its action is GABAergic. It has the ability to bind to the GABA receptor or inhibit its degradation. Yes. Okay. And then I have dealt with those plants that can calm my anxiety or those supplements that can calm my anxiety. And now I'm going to those plants that are going to soothe my digestion. And look, I'm going to go a little further, right? When I look for an algorithm for dyspepsia, depending on the type of dyspepsia, I can go to different types of plant-based active ingredients. And basically, I'm going to work with these plants here. But I want to make a point about a topic that stuck with me. It was etched in my mind many years ago, and I want to share it with you. It's a very unknown topic, but I want to share it. When I see this 2009, this algorithm, and I handle plant-based drugs that regulate liver function for dyspepsia. Look, this is an article from the magazine Disco y Salud. Well, there are good things and there are bad things in my opinion, but there's an article you can look up online and it was written by a guy, a character, a therapist named Josep Maria Cardesin, whom I met and had quite a bit of interaction with. He's from Barcelona, then he moved to Cartagena and passed away about a year ago. So this is from 2007. And he talks about liver syndrome and its concomitances. And I loved it. I always use this a lot. So more or less, the guy was saying that it's about liver inflammation, the consequence of a bad lifestyle, right? There's like a stenosis at the level of the portal vein. So it creates, I think they laugh at me when I'm out of the loop. It creates a pressure difference where there's low pressure in the upper half of the body and a lot of pressure in the lower half. So that liver inflammation can explain a problem with varicose veins or hemorrhoids. A lot of pressure downwards, and when there's low pressure upwards, I feel like I'm suffocating. The heart doesn't pump well, so it causes an arrhythmia and not enough blood reaches the brain, which can explain a depression. Damn. Keep that in mind. And the thing is, if I improve liver function, regardless of how we're going to provide serotonin later by improving liver function, from an integrative model, I can also possibly improve brain function, especially when it comes to depression. Do you understand where I'm going with this? Damn, let's do a liver cleanse for this patient who has such an interesting condition. I haven't put his name here, but it's Josep Maria Cardesin. Okay? And now let's focus on depression and plant-based substances for depression. This master's program focuses on scientific evidence. Expert opinions have value, but it's lower than in vitro tests. We can eliminate cancer in a petri dish. Simple. Here you have the typical pyramid that shows you that whatever an expert says has its value, which is quite low compared to what you test in vitro. We can easily wipe out cancer in a petri dish. It's very simple. I just put a little bottle in there and it all goes away. Researching with animals, depending on the type of animal, is not the same as using a mouse versus a macaque. We can easily wipe out cancer in a petri dish. It's very simple. I just put a little bottle in there and it all goes away. Researching with animals depends on the type of animal. It's not the same, the mouse, as it is with a macaque. The cases, the studies complicate the issue even more. It's not the same to have a sample size of N and a sample size of 500, and it's also not the same if that N of 500 includes 500 controls and 500 non-controls. And if it's double-blind, neither the doctor nor the patient knows what they are taking. So when I go here to study a good methodological design, I have experienced a plant with a good design. It is the key. And it's even more solid if a systematic review or a meta-analysis, like we saw earlier with St. John's wort and Cochrane, tells you that St. John's wort is effective for mild and moderate depression, it's superior to placebo, and it's just as potent as some antidepressant medications. That's how we handle evidence. Possibly the Oxford scale is the one that best handles all that evidence. So, with a level of evidence defined by well-designed methodological studies, the degree of recommendation is A. This is an important topic. I didn't include it today, but there are clinical guidelines from the National Cancer Institute for Women with Breast Cancer that indicate there's level A evidence for depression and anxiety regarding meditation or yoga. Hey, hospitals should have meditation. They should have level A yoga. That should be established. So I say, well, let's see if there's something with St. John's wort. Well, publishing in the British Medical Journal is rare, and some who have done it have been pulled out due to mafia-like reasons. But anyway, it's very difficult to publish here. There's evidence that hypericum, the extracts from St. John's wort, are more effective than a placebo in treating depression. The British Medical Journal, mind you, for example, in 2017, a meta-analysis, which is the highest level of scientific evidence, concluded that for mild depression, St. John's wort, blah, 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 meaning there's more than enough evidence to say that St. John's wort is effective for depression, and this woman can perfectly take St. John's wort. Now, another thing is what type of St. John's wort. What should I be aware of? Meaning, what distinguishes a good St. John's wort from one that isn't as good? Basically, it's the concentration of its marker, which is hypericin or hyperforins. And it tells you that almost all clinical trials agree that it's superior to placebo and reduces symptoms similarly to antidepressants, causing fewer side effects than tricyclics and fewer than selective serotonin reuptake inhibitors. In severe depression, The studies are more inconsistent. Be careful with the preparation because I need to be within this action range. The ideal would be 300 milligrams of dry extract with 0.5% hypericin up to 3 times, meaning a limit of up to 900 milligrams of a dry extract of St. John's wort with 1.5% hypericin. In that range, you can move around and then you go to the information sheet. For example, for St. John's wort. According to the EMA, let's say I go to the EMA sheet. I don't remember, Juan. How much did you say? Was it 300, 500, 900? Well, it doesn't matter. I'll check what it says. I'll go to the St. John's wort sheet and see how much they recommend. According to the agency, the European agency says that a dry extract is, for example, 600 milligrams once a day, or in this range, 2 to 3 times a day. So I'm looking at 1200. Let's say I want to go for 1200, a maximum of 1200 a day, and I get this product. That has 175 milligrams, plus it's in a range of 3.5 to 6.1. So what I'm giving is, let's say it's 5, not 5%, 75 per capsule. I'm providing 600 milligrams. Since I want to reach 1200, I know I need to give 2. That's how you need to handle this type of product. But for example, if I look at this product that tells me I can't go outside this technical area, I can't see well where it is. If it's St. John's wort here, no, I think we're at 1200 over 1000. Well, with this one, just one is enough. I'm already in the range. I could give this woman St. John's wort, but I have a problem. And the problem is that she's on triptans. So I have to check the technical data sheet. In this case, St. John's wort is more problematic. And the triptan would be among those medications that interact with cytochrome P. Therefore, the effect of St. John's wort on the case and the course of action would be to stop the administration of St. John's wort. Having made this note that the woman could possibly take St. John's wort. So, she could take triptans. Let's assume she's not taking triptans, okay? I'm telling you this so you can be careful with the medication she's taking. Is it an endogenous depression? Do you remember? Where does St. John's wort act especially? Within the monoamine theory, it tells you that depression is basically caused by an imbalance of these 3 amines, of those 3 neurotransmitters. St. John's wort basically helps with the reuptake of serotonin. Okay? Yes, it only acts here, but hey, I'm missing these 2. Let's see if there's an active ingredient out there that can also provide me with an adequate concentration of these 2 neurotransmitters. Do you know this? Saffron? Saffron has color that comes from an active ingredient called crocin. One scent, one aroma that comes from saffrano. Well, crocin inhibits the reuptake of dopamine and norepinephrine, and saffranol inhibits the reuptake of serotonin. Maybe a product that combines St. John's wort with saffron, since it's endogenous, would cover all 3 neurotransmitters. Damn it, I'm going to combine St. John's wort with saffron. In fact, look, saffron, a systematic review, which is the highest level of scientific evidence, tells you that it's also useful in depression, managing those concentrations that we find in the monographs. Do you see how we can handle these things?